So, welcome to this special roundtable discussion hosted by PLOS Mental Health, which will focus on youth mental health, particularly stigma, and how it varies regionally and what we can do to combat it. It's a genuine privilege for me to be joined today by three inspiring mental health advocates from different parts of the world who dedicate their lives to improving mental health for all. And the theme for Youth Mental Health Day this year is Share Support. And this is absolutely something that links all three of my guests today, and I hope we can all learn from and be inspired by our discussion. So I'm only going to briefly introduce each participant so that I can give them a chance to introduce themselves, because I won't be able to do them justice. Today I'm joined by Alex Mpaata, Geetika Sawhney and Suzanne Fox. So Alex is a community psychologist in Uganda and the founder of PYFU, which is a non-profit organisation led by psychologists, psychiatrists and social workers, and it aims to create and build communities of mental health champions and empowers communities to fight stigma. And that work spans across different sectors, including but not restricted to educational settings, healthcare, other workplaces and also home settings as well. Alex has been inspired partly by his experiences as a researcher over the last decade at Makerere University School of Health Sciences, Mulago Hospital and Medical Research Council, and he's a member of the prestigious Minova Fellowship. Geetika is a mental health professional in India who practices trauma-informed queer, trans and neurodivergence affirming therapy in their practice through a multicultural lens. And this demonstrates their appreciation of the role of intersectionality in mental health. Geetika also has a keen interest in building community well-being through the convergence of play and existential humanistic approaches with nature-based interventions. And they're also part of the Global Mental Health Peer Network, having joined when I did in October 2024. And last but certainly not least, we have Suzanne, who is based in the US, and she's the co-founder of the Yellow Tulip Project, and she founded this with her daughter Julia in 2016. And the Yellow Tulip Project is a youth-driven movement that aims to eradicate stigma and build communities in order to help provide a safer society for young people. Suzanne served as the movement's director until 2023 and is currently the director of global initiatives. She's won numerous awards for her advocacy, including the Sir William Darling Memorial Prize from University of Edinburgh, and I'll be putting details of all of those awards along with more details about all of our panellists in the blog that accompanies this recording. So thank you all three of you for being here today. I'd like to hand over to you now to give you a chance to tell us a little bit more about what you're all about, and what it is that you do day to day and how your current mission came about. So if I could please start with Alex, please just let us know, what is it that you're doing every day and how you came to be in this position?
It's a great honor to be here. Thank you, Karli, for the invitation. And are you able to hear me? Am I audible enough?
Yes.
Okay, that's awesome. Thank you for the opportunity of being a part of this conversation today. As introduced, my name is Alex Mpaata. I am based in Uganda, East Africa, and I'm a community psychologist by profession, and I run a foundation called Psychiki Foundation. Psychiki is a Greek word to mean mental health. So in short, it is PYFU, and we basically work with young people. The biggest percentage. Uganda is made up of young people between the ages of 11 to 35. It makes 70% of our population. So we are the second youngest nation in the whole world. So we have a lot of young people here in Uganda. So we deal with young people, and our focus is about mental health. And basically we are doing sensitization, helping them to understand what mental health is, but also helping them, skilling them, giving them skills of how to manage their mental health so that they're in good state, but also to empower them to support any people in their communities if they identify them as potential people who are having mental breakdowns and make the right referrals to the right people. That is, we are doing that basically in schools. Currently, we are working with 4 schools, and which is a population of about 5,000. And these young people, what we are doing in schools, we have formed what we call the mental health clubs in the schools. These clubs are run by the students themselves. They have a leadership, but within the clubs, they do different activities, such as drama skits, games. But all of these activities they are doing, they are themed around mental health. So we do not just come and start talking to them and lecture them about mental health, but we use a vehicle of sports. So through sports, we reach out to them in schools. So they play football, they play netball, they play games, but every game is themed under a topical related to mental health. We can play football that is oriented about depression and anxiety. We can play football about self-esteem and self-efficacy. So all our games are being themed around mental health. So we have a manual that we use that helps us and guides us on how we reach. The purpose of why we use games, initially we used to talk to them and it became boring, it became a little bit monotonous, and they were not, them being young people, they love being engaged. So we decided to change the mode and went into sports to deliver the message to them. So we also, in schools, we have created what we call the safe corners. In these safe corners, we provide a school with a professional counselor who gives counseling sessions to the students. So the students book through their health teacher and they book for a session. Then the counseling session is scheduled for them and they come and meet the counselor at school who gives guidance and helps and makes referrals in case of anything that is more critical. So we are also doing what we call speaking compounds in schools. So what are speaking compounds? We are doing small signages with writings about mental health, messages communicating about mental health. So these messages, we pin them or we post them all over the school compound in that a student is able, as they are moving around, as they're interacting with the environment, they can easily read something that can remind them about self-esteem, something that can remind them about stress, something that can remind them about taking about their care for self. Like all our speaking compounds are goal-oriented towards improving one's mental health or encouraging them to seek any help where they feel like something is out of hand. So that is what we are doing with schools. We are looking at enlarging this at a bigger scale in the future, and as we solicit for more ways of uh, of of bringing in more resources, because the schools are so many back here in Uganda. The need is so high. The the abuse of the drug abuse, the misuse of medicines and what is on a high, but we cannot right now because we are constrained by resources. So we are reaching out and partnering with different organizations who can come and support us, and we do this work. For example, when it comes to the sports, we partner with an organization that has specialized a lot in sports. Then we bring in us the mental health, incorporate the mental health into the sports. Then we deliver it to the young people. So that is one of the sectors we are handling young people, and we are doing sensitization and equipping them with skills of managing their mental health, but also making sure that they become mental health ambassadors within their communities where they come from. So that where we cannot reach, they are able to reach and also give this right information to people in community. Why? Back here in Uganda, I'll speak for my nation. Mental health is looked at as witchcraft. Mental health is looked at as something that makes you be banned out of community. You can't just say you have your family. They start stigma around it is so big. So and people lack the knowledge. The knowledge gap is so big. People lack the knowledge to understand that this is an illness that comes like any other illness, and it is treatable if you came early, and it can also be avoided if you did the right things that help you manage your own mental health. So we are educating and bridging that gap. Secondly, we also do hospital activities. So in the hospital, currently we are working with one hospital and we directly work with the ward that is in charge of mental health. So here in Uganda, it's called Ward 14. So when you go to hospital, Ward 14 is the mental health ward. So what we are doing, we are providing psychosocial support to patients. We realize that a number of patients are not adhering to their medication, and this has caused them to get off medicine and made the problem also bigger. Why? They lack psychosocial support. Even their patients, some of them are brought to the hospital, but they do not know what they are suffering from. Even the caregivers do not understand which kind of disease this is. Why is someone behaving like this? Why is someone speaking to themselves? Why is someone saying they are dreaming this kind of dreams? Like even the caretakers, they have come to hospital, but they are not aware of what is this. All they are looking at is the physician to tell them what to do. So we realize that we need to educate them so that they first of all understand what kind of problem they are dealing with. Then after they have understood, we also help them to accept so that they know that this medication they are taking is important to them for their well-being. So we give them that support we give them therapy of talking to them, but we also come in with other activities such as physical exercises. So we have a physical exercise day in the hospital where both outpatient and inpatients, we teach them, we talk to them, we tell them the importance of keeping fit, the importance of them exercising and how it helps their mental health. However, there's a challenge back here. One of the biggest challenge we have besides stigma and other issues that I'll speak about later is the challenge of lack of medication. So here the medicines are not readily available. There's a high scarcity of medicine. So someone will come to get medicine in the government's facility and they're supposed to get 3 kinds of medicines for them to go back home. They will come and only get 1 kind, and the other 2 kinds, they are told to go to buy them. But these are people who live under $1, and mental health medicines are expensive because they need quite a number that takes them throughout the month before they make another hospital visit. So when they come and they cannot afford, they just go back home and live on what has been given to them. And if they retard or relapse, they just live normally because there's nothing to do about it. So what we did is we decided to group them into a group of 12 people, 6 patients and 6 family members, plus 1 profession or 2 professions, a psychologist and a psychiatrist. And we started group therapy that we are giving. But in there, we ask them to speak to each other and provide information to each other of how to manage their challenges in their day-to-day lives. So in the same groups, we have introduced a financial literacy skilling, whereby we have decided to see that we skill the patients and their caregivers with financial literacy so that they are able to start up small income generating projects and they do not be dependent on government fund of hospital bills, and also not be just dependent on their family members, because someone who is aged 40 to just be in his father's house and mother's house because they got a mental illness, it is frustrating for the family. Besides the family, also let's start a group whereby we can empower them with skills. So we make them save little monies below $1 and what. So in the group, they save little monies. So when some money has accumulated, we give one member who has identified a project they can do, for example, poetry or piggery. The easiest here are poetry and piggery. The demand for piggery here in Uganda is high, like pork is on a high thing. You always have someone who will buy it. So these guys, they start up a small business. You start up a farming business of about 2 piglets. So someone can get 2 piglets. They construct a shelter. They start taking care of it. Now, this is a patient taking care of these piglets, and they grow. And if it gives birth, it can give birth like to 12 or 15. So the multiplication effect is a little bit big. So you find out that his or her farm is growing. But we have seen this produce results. How? These people have gained more self-confidence because they have reason to live. someone looks at his farm growing and they are happier as a patient. So they have more reason to take their medication even when they didn't want to take, because they have something that pushes them. So the adherence has also increased because someone has found more purpose. Because when they go out to look for jobs, no one wants to employ them. The moment they know in the village that you are mentally not okay, you have ever had a mental problem, everyone thinks you are incapacitated. There is no, they can't give you a job. They think you will disappear. They think you will run mad with their money. So we are empowering them financially so that even when they go to the hospitals and they cannot afford, they cannot get the medicines, they have some money to buy that medicine so that it keeps them going. So those are the two areas we are tackling. In the hospital, we deal with the patients both in and outpatient, and we give them that psychosocial support, the group counseling that happens for members to talk amongst themselves about the different challenges through the care of a physician or a psychiatrist or psychologist who is available, so that they know that someone is moving with them and they are not alone. And we have seen this work, but also it has also educated their family members to know how to care for their people better, to also understand more about the illness, what it means and what it's about. And also they have become ambassadors in their communities, whereby they are telling people, this illness you have is not witchcraft. Go to the hospital and seek medication, because people come late. The challenge we have here, people come to the hospital very late when the episodes are very, very bad. Someone gets an episode and comes after 5 years, and in 5 years, they've never stepped in the hospital. What do you expect? So we are building that knowledge gap, and we also go in the community to hold community dialogues about mental health. So that's what Psychic Ygeia Foundation currently is doing, as we are looking at expanding more way of reaching out to more people to bridge the knowledge gap, but also to sensitize communities and young people specifically about mental health well-being. Any questions are welcome. Thank you very much.
Thank you, Alex. The two things that stand out for me, I love that you have a big focus on sports and that kind of thing, because I think it also means that often children or young people are engaging, and they don't even necessarily realise they're engaging in a way that is better for their mental health. So their guard might drop a little bit, or there's less stigma. And also, I love that the focus of your work is capacity building and the ripple effects of empowering and educating. So thank you. So Geetika, can you let us know, please, what it is that you're kind of doing on a day-to-day basis to tackle youth mental health stigma and how you got there?
Yeah. Hi. Yeah. So like you said, I think my work is the approach center is based like centered around a community sort of mental health approach, and so most of my work is also working with sort of gender sort of queer and trans identities, and also a lot of disabled identities also. And when I talk about this work, so a lot of this work that I do is also in sort of my independent practice and as in the capacity of a therapist, and I also work in a school setting as well. And so when I work in these spaces, the approach is sort of rooted in sort of ideas of play and nature-based work. And when I also, I think, talk about play and nature-based work, I think over time, I think in the recent like years, a lot of these sort of modalities have taken sort of stage where arts have been looked at spaces like sort of alternate spaces to sort of express yourself and access well-being through, where it does not really need you to use language. So I think also it's important for me, it's been an important learning for me in the past couple of years to also look at arts or nature also through this lens of intersectionality, because the important questions that have come up is who even sort of gets to play or who has access to these outdoor spaces. For example, when I work with disabled people also, how accessible are outdoor spaces when we look at these spaces as spaces of well-being as well. And how then do we make these, like how do we work on making these spaces more accessible? And so there's those outdoor spaces are also important resources for us when we do, because I also see when we talk about play also, play is definitely, I think it brings in a lot of sort of, I think that creative agency back to people's lives, which sort of systems, oppressive systems take away from people a lot of times for this that space to be where they can create on their own, where there is space for imagination to be able to sort of, imagine different possibilities. And I think that is when also it's also important to look at play also and arts and nature as spaces which are inherently sort of rooted in a lot of like social context as well, and how we engage with arts, how we paint, how we sort of, let's say, spend time outdoors is influenced by these different social locations that we come from. Maybe my gender, because somebody who is seen as a non-binary person. And I think it's also about how I then am in those spaces, and even my clients who come from different gender identities sort of, and how they are viewed in those spaces, how safe are those spaces, even if I'm accessing outdoor spaces for my well-being, and when I am my sort of queer self in those spaces. And I think again the question is also because these are these very mediums that we look at in our work, which are these sort of mediums that we're trying to access care through. The idea is also when we move from sort of systems of harm that have caused us harm, we are also looking at simultaneously again looking at creating these alternative systems as well, because there is also, I think, while there is conversation about sort of disrupting these systems and moving away from these systems of harm, but also I think there's what we also look at is again sort of capacity building and also just building these alternate futures also, because a lot of then the current work in the present sometimes is, I've also in my experience sort of, there's a lot of cycle of sort of being stuck in that cycle of sort of trying to constantly sort of work against systems, which, and also it's very training work in that sense. So to also constantly be disrupting these systems while also looking at building these alternate systems of sort of hope. And while we are building these systems of hope and care, I think some of the challenges that we have also sort of looked at is also, I think, one is definitely the knowledge gap also, but also it's also a lot of access gap in who, because even when I'm talking about this work right now and the challenges, I'm talking like in a certain language, and I'm able to use this language because I've had that access, I've had that kind of privilege to be in those spaces where I've been able to engage in these conversations. It's a lot about, I think, um, how and who has access to these kind of spaces and conversations to even move away from these systems of harm, because also a lot of times this is the very systems that cause harm are the only ones perhaps accessible to a lot of communities as well. And so I think the idea is also to sort of, I think how in the past couple of years we've seen that there's an increase in sort of conversation about these issues, the increase in conversations about narratives which are harmful for people with lived experiences and of disabilities, varying disabilities. And I think in that process also there's been a lot of sort of appropriation of this language also. A lot of times just a lot of people have been just using this language just as sort of fancy prefixes to put sort of like, oh, I'm this person who holds like a disability inclusive space. But also when it comes to how they're embodying those sort of values, there's been a lot of distance between the language to sort of action sort of bit of it. It almost is like this, just the word prefix has become like very important in that sense that, oh, I'm just a disability inclusive sort of therapist or a practitioner, but it does not often show up in the work that we do. And I think it's been also an important learning and a challenge at the same time to look at how each of the work that we do, also there's so many layers of stakeholders involved in that. Like I may be working with an individual client also, but the person comes from like a sort of a social location. Like there's so many places. Like if I'm working with a student in a school, there are the parents involved, there is the school administration involved, there is so many other like sort of media influences or peer influences involved, the teachers involved. So I think it's been an important learning and a challenge at the same time how this work would be integrated perhaps. And that integration, I think, has been really difficult because I may be trying to reframe these narratives, reframe these harmful sort of languages that often come up or sort of are being used in everyday languages with this individual person. But then when this individual person goes back to their sort of everyday sort of lives, there is again those systems of harm continuously playing out in different everyday conversations and dynamics, how that's being held, different sort of layers of assessment that we have put through, different social processes that happen around us. So I think it's been an important question that I'm also currently sitting with, that how do we integrate this work at these different levels of sort of stakeholders as well. And something I think that I constantly hold on to and which gives me a lot of hope also, I think a lot of times is also, I think more than sort of prescriptional work, a lot of more, I think work which is sort of more inquiry based work, but there's more curiosity. Curiosity has been a very important thing to sit with in this work rather than telling people what to do. Just, I think, just asking those questions when it comes to sort of, because I think especially in healthcare, there's a lot of questions, sort of ideas rather around, oh, what is good health or what is bad health? So like there's a certain idea of good and bad health, but then also something that we want to like, that's something I sort of hold very closely in my practice, is also to just see what are these definitions of good health, or what is really good or what is really bad, and who decides then what is good and bad. And sort of a binary also that again we want to sort of create more space around, and just not just within these boundaries, but look at also just the possibilities around, like, okay, there is can be this and there can be that. So holding those spaces of contradictions and paradoxes also in the system, because there is just, I think each idea of good health and bad health also again is placed in such a social context of what can be good for one person may not be good for the other person and things like that. So I think just placing those ideas of what even is good health, I think that's been a really central question to my practice every day when I engage with sort of students also, young people as well, and adults as well. And yeah.
Thank you. I think it's, just learning about what you do day to day, both you and Alex, it's very, very clear already what the major challenges are, whether it's resources or education or just trying to change narratives that are just so ingrained in communities. And obviously Alex is in Uganda and you're in India, Geetika. But Suzanne, in the US, obviously there's overlapping circumstances and there's a lot of differences as well. So what is it that you're doing, or what Yellow Tulip Project is doing day to day, and what kind of challenges come with that?
Sure. First of all, I just want to say how exciting, what an incredible opportunity to hear about the work that you're both doing. Alex, when you're talking about the mental health clubs, the Yellow Tulip Project also has a very vibrant ambassador program with young people. And Geetika, the stuff that you're doing with nature-based interventions, and we're also doing a lot of more innovative approaches to addressing stigma through art, storytelling, garden work. So it's really lovely to hear about your work and to always learn about collaboration and what we can learn from each other. So the Yellow Tulip Project I started with my daughter 10 years ago. 10 years ago, Julia was 15, and she was struggling alone with her own suicidal thoughts, depression, self-harm. I was her parent. I think I'm a pretty good parent, and I had absolutely no idea that my daughter was struggling. 2 months after that, she told me before she started her high school year that she wanted to get healthy. She wanted me to learn about what she was going through. And then 2 months later, her very best friend took her life. 2 months later after that, her second best friend took her life. So my daughter's alone with her self-harm, depression, having just lost her two best friends to suicide. The headmaster at the school, the day after her first friend took her life, said to the whole school community, now that everything's back to normal, and that nobody talked about it. And my daughter said, Mom, there's nothing normal about what just happened. And yellow was her friend Peyton's favorite color. The tulip was her friend Beata's favorite flower. The yellow tulip is the flower of hope. So 10 years ago, my daughter and I had an idea to take mental illness, which is often in the shadows. People don't want to talk about it. We talk about our physical health, but we need to talk about our mental health in the same way. So we had a simple idea in the state that I live, Portland, Maine. to come together during Mental Health Awareness Week in October and plant a hope garden. Get your hands dirty as a community. Come together, speeches, music, poetry, wellness activities, and the simple act of planting a garden together brought people together with a sense of community and a sense of hope. And then when the tulips bloom in the springtime here, the tulips, the yellow tulips, to grow need to be planted close together. And you can't see what they're going through in the dark, cold soil, but they come up and they're beautiful and they're so special. Just a perfect metaphor for anyone suffering from mental illness, that nobody should go through this alone. And you can't see what people are going through. So in the springtime, when the tulips came up, people came together to sing, support each other, wellness activities, etc. So that's how we started, simple, but just taking this into the communities. The second thing we did, Alex, is like what you're doing with the schools, is this was never about my daughter. It was never about her two friends. It was about hope and smashing the stigma. So we started an ambassador program. And 10 years ago, nobody was talking about mental health. It's getting better for sure. I think we have a long way to go still. But 10 years ago, it was really rare to talk about it. And my daughter talked about it, and she gave a TED Talk. And then she started speaking at high schools. And the way that young people are connected, this student knows this person on this sport team, this person does drama. It was just amazing how it spread. And we started an ambassador program. And then it became clear that mental illness is not a young person thing. It impacts everybody, from older people, younger people. So we went down to work with younger students. We went up to work with veterans and communities. So we have, if you are a younger person, if you're a student, if you're a community member, come together first through the gardens and planting these gardens. Second, through action, which is the young people sharing their stories, the young people getting involved. I'm young at heart, but I'm not what I'd call a youth anymore. But I've had the incredible privilege, when I was the executive director of the Yellow Tulip Project, to work with these brave and honest young people, teach them how to share their stories. They write, they share their blog, they tell their stories, they organize at their schools, and the adult allies that support them. So what we started, the two of us, a mother-daughter group in a small state in the United States, has spread all across the United States, with communities getting involved, with schools getting involved. And for me, I'm working now on global initiatives. Last year I did a master's degree in global mental health. And I'm so inspired by how much we can learn from each other, because this is such a global issue, as we all know. And there's issues with resources, there's issues with, in the United States, there's been all these massive cuts in mental health support. If you don't have insurance, it's hard to get a caregiver. So each country has different issues. But again, I think there's so much that we can learn from each other. I've been really inspired. What specifically are we doing beyond the gardens? The storytelling and the public art has been so amazing to see the way that I personally am not a practitioner. I don't have a practice, but I feel so strongly about the importance of taking this issue and putting it in big ways for people to, we have art exhibits that are beautiful and hopeful. People see them at airports, at hospitals, at community centers, and it challenges the way that our perceptions of mental illness. It makes us think, oh, because you can't see it and we don't know what people are going through, but it begins conversations to remind people that it's okay to not be okay, that asking for help is a sign of strength, not weakness. So that's just a short version of what we do. But again, it's really, as we're addressing Youth Mental Health Day coming up, I think the young people are amazing and they get it and they care. And I did workshops in India and in Cambodia, and a lot of work, in my personal opinion, is the older generation is more is less open to, I think the young people are just brave and honest and more open to share their stories. And I think there's a lot of stigma with the older generation that needs to be addressed too.
Thank you, Suzanne. I mean, I've heard you speak about how the Yellow Tulip Project came about a few times now. And every time you do, I just find it so moving. And I think it's such a beautiful thing that you and Julia have made out of a tragedy. I was going to move on to asking about challenges and barriers, but to be honest, I think we've already got an impression about what these challenges and barriers are, whether it's, as I mentioned before, resources, education, stigma, and what the lack of resources or the stigma or the lack of education looks like in different parts of the world is going to be slightly different, but it all comes under the same umbrella. And, you know, all three of you are working around those barriers. I wanted to ask though, since you've started on this journey of advocating for better mental health for young people, what would be the one major difference that you've seen? I'll start with Alex. What's the one main thing that you've seen perhaps change for the better or worse that's just shifted since you've started?
Thank you very much. So that one thing that that has changed, I'll just tackle for the better. With time, as we have gone ahead to talk about mental health and sensitize these young people and communities, honestly, now there is change in the perspective. There is I cannot say we have completely bridged this knowledge gap. The challenge is still there, but at least we are moving in the right direction. People now know that mental health is a challenge and it's something that can be addressed. But people now are also empowered. We may not have gotten a big percentage as of now, but the journey is on. You understand? There is change in the community. There is now we are seeing more people coming to hospital to seek services of mental health. We are seeing increase in numbers of people coming to seek services, which was not the case. People are resorting to come and at least understand. So even the small things that they used to take for granted, now parents are more keen about their children. They are more listening now. They are more engaging. They want to get involved in the lives of their young people. You understand? So that is something that is getting better and better. It's something that I can say that the knowledge gap, however much it has not yet gotten where we want it to be, the journey has started. We can see the results moving in the right direction. The worst thing is that however much the knowledge is increasing, the burden is still big. The people are still struggling. The young people are still struggling, especially people deep down in the villages. Urban centers, people are a little bit elite, they are educated, they can understand, but people who did not go to school here in Africa, trying to explain to them, the burden is still big. The burden is still big. And issues like unemployment, issues like poverty, it just makes the mental health burden bigger. Because as we are talking to them about taking care of their own self, but they cannot afford a meal. The teenage pregnancies, the early childhood marriages that are happening, the teenage mothers that are here, it just increases the burden. Because at the end of the day, it's a behavior that links you to another breakdown. It is the behavior of a parent not having what their child to eat that makes them stressed. It is that challenge of lacking what to do when a young person who has finished even the university, who has just come out of high school but cannot find any job to earn a living, the stress that comes with lack. You understand? So however much the gap is getting to in a better way, the challenge we still have is big, that the burden is still increasing. So we need more manpower. We need to add into our resources, reach out more to reduce on that. Thank you very much.
Yeah, it's a resource thing, isn't it? It's, I guess, even the most well-resourced regions, it's a slow journey, but to be so limited by resources, it's going to be even slower. But I'm really pleased to hear that you can see some changes in the right direction, and hopefully as that builds up, you know, these changes amplify as well. Geetika, what would you say is the one main difference that you've seen in the mental health field, especially in youth mental health, since starting your journey?
Right. I think, yeah, something to what similar to a long tangent of what Alex is also saying earlier, and what we've been talking about is, I think, even when I hear the word difference, honestly, like I'm thinking about the time when I sort of started, when like 6 years ago, reading, just getting into this discipline of sort of psychology and mental health. I think the kind of spaces that were there 6 years back to now, there has been definitely sort of more space that these very conversations are now taking in the first place. Maybe just, even though maybe, let's say, not every school may have a counselor at this point, but the word counselor sort of exists. Like maybe the student in each class, they know that, oh, there is something sort of a counselor, or yes, maybe a school has or does not have a counselor, but there is someone like a counselor. And again, I think this change is sort of like, it's very circular and rather a spiral, actually. Like, you know, it goes around in circles. It's a lot of back and forth process, because it does feel like a lot of days that, oh, am I sort of like starting from where I started, actually? But in that process, that spiral has also sort of somewhat moved from where that point sort of zero or point of starting was. And yeah, and I think in that sense, again, um, there is some space, but again, it's so structural. It's so many structures in place, structures, the government structures, social, political structures around us, our different identities that we carry, our genders, our caste, class, and how each of those also sort of shape how sort of this healthcare work looks like for each of us, and what is who is becoming healthy or who is unhealthy in this sort of, you know, current context as well, when there's so much political instability in the system, when the policies and how those spaces are, especially for people from marginalized communities as well. So yeah, like of course there is some difference, and there's perhaps slightly more space than what it was from what, let's say, 6 years back is when I started this sort of first started reading about psychology. But yeah, it's still circular, and yeah.
It's so frustrating to hear, not just in this discussion, but elsewhere, how slow progress is, or the fact that that progress is even needed, because it shouldn't be like that in the first place, right? It's so frustrating. But you know, what we can do is try and push the change. Suzanne, what would you say is the main thing that's changed for you?
Yeah, I think as I mentioned earlier, I think, you know, in this 10 years that I've been in this space, without question, it's more accepted to talk about mental health. We have famous actors and sports people and musicians talking about their mental health, and the stigma has shifted. I think that's a positive thing. And yet 2 years ago, the US Surgeon General, who is the highest doctor in our country, declared a youth mental health crisis. So I think, yes, people are feeling less stigmatized, and yet still there's so much that young people are struggling with. I think social media, that's a whole other conversation. We can spend a lot of time, but I think there's a lot of good that comes with social media. But I think the impact on young people's sense of self, their self-esteem, their body image, there's just so much that's relatively new in that space. And again, I do think it's the resources. So now you may feel more inclined to talk about your mental health, but if you actually want to find a therapist, it's pretty hard to do, or they don't take insurance, or you don't have access to get to the therapist. So we're making steps, and that's all positive, but there's definitely a long way to go. And these conversations are so important to have, for sure.
It's all, you know, all three of you have given me the same impression. As you said, you're making steps, but it's slow. And I just wanted to finish off, because I know we're running time now, but perhaps one last quick question for all three of you, in the interest of kind of, you know, all the similarities in your answers. Obviously, there's key differences that are very important to be aware of, but there's also similarities. And I think, you know, we can learn from each other, and I think it's so important to collaborate. I'd like to just ask you each now, just to let people know that will be listening to this, what are the kind of the main projects or goals that are coming next from you that you're open to collaboration, or if you'd like someone to reach out to you about, or just to watch with interest to see what you're doing next? I'd be really interested to hear what's next if you're comfortable sharing. So Alex, what's next for you and your organization?
Thank you very much. So one of the things we have decided to invest in most is partnership, because we've realized we cannot do everything by ourselves, but a number of people are doing a lot of things out there to see that the world moves on. So we have realized the power of partnerships. When it comes to the financial literacy and what, we have decided to work out and look for partners from the banking sector, from private companies who can give us more knowledge and skill. We bring in the mental health expertise, we combine it together with the expertise of financial literacy, and we help the patients and we help the communities. You understand? So we are open to partnerships, just that these partnerships are to be guided to see that we are still in the vision of the foundation of enriching communities with skills about mental health management, but also reducing stigma within the communities. Yes.
Thank you. Geetika, what's coming for you?
Yeah, I think so. What's coming next for us, I think along the lines of what we've been talking about earlier, is also just looking at creating these new reference points. When it's specifically, I think what we are currently looking at is for disabled children and adolescents. So just having maybe, I don't know, something that we are sort of exploring right now is looking at holding sort of group discussion spaces or support group spaces where, we sort of look at these new reference points, because when we talk about the normative, there are a lot of reference points to go back to in terms of how do we navigate our life, how do we navigate different challenges. But when you talk about different disabled identities, there are sort of not enough sort of conversations or narratives about what are these reference points that we hold on to, or what do we go back to, what are these anchors to sort of. So the idea is also to look at these futures, what are these future hopes, future reference points that we can come back to in futures also, like that we build in the present right now. And this is our hope for sort of collaboration spaces to hold with, sort of where we work with children and adolescents, and also at the same time we're looking at also another thing is sort of making spaces of sort of playfulness for adults as well, because we do realize how I think play is such a powerful tool also for just building on these conversations and sort of rebuilding, sort of initiating these reframing narratives as well. So looking at these two play spaces for adults and also these spaces for children and adolescents is something that we are looking at in the future. Yeah.
Thank you. And Suzanne, what's next for you and the Yellow Tulip project?
Sure. Well, when I decided to go back to graduate school in Edinburgh last year, I wanted to see if the Yellow Tulip project's message of youth empowerment, community building, stigma reduction was unique to the United States, or what would it look like globally? And when we planted a Hope Garden on the university campus of this 500-year-old institution, and people from Colombia and Argentina and China and Malaysia and India and Saudi Arabia shared their stories and planted the garden together, it was so clear to me that this is such a universal issue. There may be tulips might not grow in Uganda, but you can still come together and plant a garden. So I've been having the most amazing time working with collaborators in Nigeria and in India and in the Arctic. And again, Alex, as you said, nobody can do this work alone, and any place to learn from each other, collaborate, inspire more young people. It's just absolutely essential. And so my hope after this session is that Alex, Ygeia, and I can exchange information. And Karli, thank you for bringing us all together. But it's always so inspiring to learn what other people are doing and where the intersections are for collaboration.
For sure, definitely. And thank you all again for being part of this discussion today. It's always, every time I do one of these, it's always really eye-opening to me to compare and contrast mental health barriers and initiatives across the world. And also there's never, I hate this narrative of like a unidirectional learning between low-income and high-income countries. It's not like that. It's bi-directional. everyone needs to learn from each other, and we all need to remember we're all part of the same diverse community. And I think it's especially important when we are concerned with the mental health of our future generations. And the world seems to be getting more and more temperamental. So bringing everyone together, for me, is the way forward. We can all learn from each other. And again, you know, as ever, PLOS Mental Health will continue these conversations, and I love being able to bring you all together. I think you all inspire me, and this was totally me being self-indulgent, bringing you all together, and I really enjoyed it. And I do hope that you'll be able to work with each other, and if I can help that in any way, then just let me know. But thank you to all three of you for joining me today. And if anyone listening to the recording wants to reach out, just let me know and I'll coordinate something. So thank you.
Thank you so much.